Yes, today we're in the operating theater to perform a rhinoplasty. This is going to be a primary rhinoplasty operation on a patient who has never been operated on the nose before, which makes things much easier for us. I hope her change will bring her a lot of good luck during her whole lifetime. All right, so do you feel a little bit high, maybe? Just like you had a couple of drinks? Okay, great, enjoy. Now we're going to give you something stronger very soon, okay? So you're lucky enough to be operated in the hands of the greatest anesthesia team in this area. So they're really very good at what they're doing. All right, now you're going to feel a hot flash on your face, and then you'll be in very deep sleep, okay? It will take seconds. Ready to go? Okay, boom. Here we go. Enjoy your sleep. Okay, so now the anesthesia team is delivering the first step of anesthesia to the patient. This is the stage that we call induction. And at this stage, they're putting the patient into a very deep sleep. And they're controlling the blood pressure in a very stable way. This way, as the blood pressure is under control, as it's not fluctuating, the patient goes very stable during the procedure, and the bleeding, so the consecutive bruising, is much less when compared to an operation in which the blood pressure goes up and down. So without the help of this beautiful anesthesia team, we couldn't manage to do that. So they're doing a great job to keep the blood pressure stabilized. Yeah, so it's been almost 20 minutes since the patient left the room, but as you see, still couldn't start the operation because the preparations are going on. This is a long story. First of all, the anesthesia is delivered, the patient's put to sleep, and then the face is sterilized completely with sterile solutions, and then the face is draped, and then the team washes their hands in a surgical hand wash pattern, and then we put on our sterile clothing, and then the operation starts. So now I'm sure that the companion of my patient is thinking that the operation already started, but this is the way it goes. So this time that we're spending here does not add to the operation time. Okay, so this is the pre-op wash. This is what we're doing every single day with these hard chemicals. This is the surgical scrub where no bacteria can live in this. So this foamy material is the first step. And after we're finished with this, we rinse our hands like this, because some believe that this is a toxic material. And then we switch to the second stage. We're not touching our hands anywhere anymore because we assume that they're sterile. And this is to avoid bacterial colonization in our hands during the operation, because if somehow our gloves are torn, we don't want to expose our patient's body to the bacteria that we have in our hands. So before any kind of surgery, the surgeon washes his hands in such an intense way. All right, so let's go. Right, so we're all prepped. The patient's asleep. We are ready. And we injected some local anesthetic solution around the nose in order to block the blood supply to the nose for a temporary period. And this gives us a bloodless surgical field, a drier surgical field. But when we are delivering this local anesthetic solution, the blood pressure comes a little bit high. And now the anesthesia team is keeping the blood pressure under control and like reducing the blood pressure so that we'll be working in a completely bloodless field. So now the operation is over. My patient's in the recovery room. This is a place where the patients are gaining their consciousness back. They're waking up actually. And she's going to spend some time, like 20 minutes in the reanimation room. And after that, she'll be taken up to her private room again. And then I'll go and inform the people waiting for her that everything's fine. So basically what we did is called a closed preservation rhinoplasty. This is my favorite and it's getting more and more trendy these days. The rationale behind this is preserving the dorsal lines of the nose and getting rid of the bump in an indirect way. So at the end of the day, we don't have the bump there, the bump's gone, but we preserve the dorsal lines of the nose and we don't we disintegrate the elements of the nasal dorsum.